So, good morning or good afternoon, everyone, depending on where you are. Thank you for calling in to be part of ECCN's um, webcast today, all about Return to Learning, an initiative for forcibly displaced children. So, to start with, I'd like to give a brief overview of ECCN to tell those of you who are unfamiliar with it a little bit more about it. And so, ECCN is a forum for collaboration which brings together various organizations for knowledge sharing and networking and producing goods that are used by various implementing partners that USAID is supporting. And the goal of the equity task team, which is where this webcast is coming from today, is to try to promote increased access to resources for improving equity in education and crisis and conflict affected environments. There are several priority areas for ECCN, as you can see. There's work focused on safe learning environments, work focused on improved programming, enhanced equity, and also local institutional capacity development. So as I mentioned, this is a partner initiative for ECCN, and what these partner initiatives provide is an opportunity to showcase timely and important research on issues of education in crisis and conflict-affected settings. And so Save the Children was one of the 5 partner initiatives selected by ECCN this year, and that's why we're happy to talk to you today about the Return to Learning program. So our presenters, so we have Melissa Chiappetta, who is a senior research and learning advisor for USAID. Melissa specializes in performance management and evaluations of education and agriculture, food security, and nutrition projects in developing countries. Melissa is an experienced performance management and evaluation trainer and has facilitated numerous trainings for staff from USAID, the US Department of State, and multiple private and nonprofit organizations. We also have Dr. Ali Kruper, who is a senior specialist in education in emergencies and is a member of Save the Children's research, evaluation, and learning team. Ali's work focuses on education for those affected by violent conflict, migration, and displacement, specifically engaging in the monitoring and evaluation of education programs and planning. We have Sarita Fritzler, who is a manager for humanitarian response with Save the Children. And in this role, Sarita provides leadership to Save the Children's humanitarian responses to ensure that children are safe from harm, exploitation, abuse, and neglect. Sarita also manages the emergency health unit at Save the Children and provides technical assistance in both child protection and education in emergencies programs. And finally, we have Julia Jonah, who is an education and emergencies advisor with Save the Children. And in this role, she provides technical support to Save the Children's education and emergencies portfolio, which includes projects throughout the Middle East, East and West Africa, and Asia, with a specific focus on alternative education, social emotional learning, conflict sensitivity, and school safety in both the formal and non-formal sectors. Our agenda for the webcast today. So we will begin with hearing from Melissa about the new U.S. government education strategy and USAID education policy to learn about the importance of assessment in these documents. I will then begin by providing an overview of Save the Children's Return to Learning program. My colleague Sarita will then talk us through the pilots that were conducted of Return to Learning's activity toolkit. Ali will then discuss our pilots of the HALDO assessment tool, and we will conclude with our current implementation and plans for the future. So, Melissa, over to you.
Great. Thank you so much, Julia. So I wanted to just give a little bit of an overview about where USAID is at currently with its new policy and also the new US government strategy, and kind of put into context the presentation that you're about to see. So I think, as you all know, there is a huge need for programming to support children and youth in emergencies and crisis and conflict situations. There are approximately 32, 33 million children who are asylum seekers, internally displaced persons, or refugees worldwide, according to a 2017 UNESCO report. And only about half of those children who are primary age attend primary school in those settings, and only about a quarter of them attend secondary school. We also have a huge focus on addressing the needs of marginalized children and children that are affected by crisis and conflict, both in the US government strategy and the USAID education policy, which were both released in 2018. So just wanted to highlight a couple of key points from the policy. Specifically, the first two priorities of the USAID education policy. The first one, it reads that children and youth, particularly the most marginalized and vulnerable, have increased access to quality education that is safe, relevant, and promotes social well-being. So this is our first priority under the new education policy and directly related to the content of this session. The second one is that children and youth gain literacy, numeracy, and social-emotional skills that are foundational to future learning and success. And so I think what's really exciting about the new policy is that we're not only focused on access as we were in the past, but ensuring that those marginalized youth not only have access, but have access to quality education. And part of that really requires that we're able to determine what the status is of education in the country currently, and really to get a good understanding of the context before we start any implementation of programming. A couple of other key points from the policy that I wanted to highlight. One that says we must ensure that our assistance supports evidence-based programs and reforms in pursuit of measurably improved outcomes for children and youth. There's a really strong focus within the new USAID policy on evidence to inform our programming and on ensuring that we've conducted contextual analysis and we've done a deep dive to really understand what are the causes behind any of the key challenges that children are facing with achieving literacy and numeracy outcomes. Another quote, research and evidence must be relevant to the local context and translate into policy and programmatic decisions. So we don't want to be conducting research or gathering evidence for the sake of gathering evidence, but we really want to have actionable research that is used to inform our programming. And I think this is something that's always been a goal of ours, but we're moving more in this direction now and really ensuring that recommendations from evaluations, formative evaluations as well, can really be used to inform programming. And I think a lot of times in the past, we were unable to use the findings just given the timing of assessments or the quality. So I'm excited about the new focus on this. And I think the presentation that you're about to see about the HALDO tool is really interesting and will help us to better contextualize some of our programming in emergency situations. And the final quote here is, reaching marginalized and vulnerable populations requires a deliberate focus. Assessments of equity and inclusion should inform policymaking and programming. These analyses must inform the design of programs and infrastructure practices in and out of school and the allocation of resources. So just to further highlight my point around how important it is that we are really assessing the situation before moving into to develop programming, and we're designing to address the key barriers that are faced within a system. Okay, so I will come back at the end to place this a bit further in next steps and how this might be of use to you all, but I'm going to go ahead and turn it back over to Julia.
Thanks, Melissa. So I'd like to give you an overview of the Return to Learning program. The Return to Learning program was designed partially in response to the 2016 New York Declaration and then the subsequent Global Compact on Refugees in 2018. And if you're unfamiliar with the Global Compact, what it calls for is for hosting countries to make sure that they can contribute the resources necessary to expand access to quality education for both refugee and host community children. We know that forced displacement has become such a huge issue, and so this document really is ensuring that governments are preparing and doing what they can so that children on the move and children that have experienced forced displacement don't have their education disrupted for too long. And the aim of the Global Compact is really to minimize the time that refugee children spend without access to education. And the goal is really to ensure that they have access within 3 months of arriving in the new country. So we've been given this 90-day requirement. And so in responding to the Global Compact, we started thinking about a lot of the challenges that children often face in accessing education, especially immediately when they arrive in a new country, or are even internally displaced. And that's really what led to us creating this program. Okay, so what is return to learning? Return to learning, as you can see here, is a rapid response education program. As we often know, that in times of conflict and crisis, education, it's not only an underfunded service, but it often takes a lot of time to provide children with this access to learning opportunities, regardless of the fact that when you talk to parents and community members, education is frequently one of the most requested services. And so the Return to Learning program aims to provide children with access to learning during the first phase of humanitarian response to ensure that we can help children regain that sense of normalcy, establish that sense of routine as quickly as possible to support their well-being and also their learning. So there's three main components of the program. We have the HALDO assessment tool that my colleague Ali will be talking to you more about a bit later. We also have activity toolkits um, for various developmental levels, and then facilitator training materials. Okay. So, to talk a little bit about the activity toolkits, so you have more information, um, the activity toolkits all focus on addressing children's literacy, numeracy, and social emotional learning skills. And we've developed three different toolkits depending on developmental level. So we have an emergent level toolkit for children that are typically ages 4 to 6, and this provides them with access to emergent and yes, emergent literacy and numeracy and social emotional skills. And a lot of this material comes from Save the Children's Ready to Learn program, which is our ECCD program that we use all over the world. We also have another toolkit for children roughly around ages 7 to 11, but this is for the developmental level that we consider to be foundational or intermediate. So obviously, sometimes children may be a bit older, but still be at this developmental level. And so this level is really trying to provide access to these foundational basic skills. And then the final toolkit is our advanced level, typically for children around 12 to 15, but again with some slight variation. And this really focuses on reinforcing those core foundational skills that were taught during primary school to ensure that they can continue their education at a more advanced level. And so there are 20 sessions for each activity toolkit for each developmental level, and each activity session is roughly 45 minutes to an hour. Um, and as you can see, and as I mentioned, all of these activities have been pulled from various Save the Children programs. So for teaching literacy and numeracy skills, we're pulling from our evidence-based literacy boost and numeracy boost programs. To support social emotional learning, we're pulling from our learning and well-being in emergencies program, and also the Ready to Learn for ECCD age children. And so the structure of the activities that are in the toolkit, each activity plan follows the same structure. So we begin with a welcome activity. And this really, the purpose is to welcome children in, give them some fun way to interact with each other right at the very beginning of class. So often through a song or a dance or reviewing each other's names to greet each other, something like that. We then move on to a mindfulness activity. And the purpose of these activities are to help children really focus on the present, to get their mind, into the correct mindset so that they can prepare to start looking at the more skills-based content, which then we move into the lesson content itself. Each activity plan typically focuses on 1 to 2 skills that are normally a combination of literacy, numeracy, and social emotional skills. And all of these skills are mapped out in a scope and sequence in the beginning of each activity toolkit. And we do try to have skills build on each other as children go through the activities. And then we conclude with a closing activity. And there's several objectives of the Return to Learning program, but the diagram you can see on the right, this is to highlight that the objectives of this program are all aligned to Save the Children's quality learning framework. And so we're using a holistic approach to support children's learning and well-being to really increase their readiness to re-enroll in school. And this involves supporting the child at various different levels. So looking at the child's social ecology and making sure that we are preparing teachers or community volunteers. Since this program is designed to be rolled out very quickly, it does not require using a formally trained teacher. It can really be implemented and supported by any community member who is eager and willing. And so looking at the teacher level, since they're directly interacting with the children, and also looking at how we are engaging with parents and caregivers to reinforce what is taught and what is discussed in these learning spaces in the home and in the community. And really making sure that parents and caregivers have an understanding of their role in supporting their children's learning and well-being. And through this approach, we're able to provide children with specific support based on their needs to help increase more equitable learning and well-being outcomes for them. And the final interesting piece of information about this program is that it's providing us with a great opportunity to be more coordinated with the work our child protection colleagues are doing. So, as I mentioned, since Return to Learning can be rolled out in any community space, um, it's giving us the opportunity to make sure that children have access to a safe and secure space to learn. And that can happen very quickly. We don't have to wait until there is access to a formal classroom. It can be rolled out in any community space. And right now, which Sarita will be going into more detail about, we are working with our child protection colleagues to make sure that this program becomes a part of Save the Children's Global Child Friendly Spaces Toolkit. So making sure that children, even when we're thinking about their protection and safety and well-being, that they also have the chance to work on improving some of their literacy and numeracy skills. And so with that, I'll hand it over to Sarita to talk to you about the pilots we conducted of the activity toolkit.
Great, thanks so much, Julia. And like she said, this is a really unique program in that we have strong integration between child protection and education. And we piloted this program in two contexts last year. First, we started in Melilla, Spain, and then we piloted in Serbia. And we picked both of those locations because, as you're probably all aware, in 2015 there was a massive refugee influx into Europe, and both places, Melilla, Spain, and Belgrade, Serbia, had to respond to the growing numbers of refugees coming in. And last year, both contexts were still receiving refugees crossing over the border. So we were able to work with children on the move who were not in permanent locations, who were trying to move to other parts of Europe, who were going to Scandinavia seeking refugee status or asylum. So in terms of Melilla, Spain, we went to Melilla at the end of June last year. And for those of you who are not aware, Melilla is on the Moroccan coast. It is a Spanish enclave, and it is the port of entry to the EU and a major trading post for Spain. And with the refugee influx, this border in particular saw a massive increase from 2016 to even last year of Yemeni, Syrian, Iraqi, Pakistani, Afghani refugees, as well as sub-Saharan African migrants coming over as well. So this city is an completely walled 12-kilometer radius city, and it has a border that completely walls the city. And it is heavily patrolled by Border Patrol. There are checkpoints at every couple kilometers, and you have to. It's a highly protected area. Save the Children has been working in Melilla, Spain since 2015, since the refugee influx, and they operate one child-friendly space. They also operate programs with refugee children at the asylum center, where they're waiting for their asylum process to go through so that they can move on to the main, they get on a boat and go to Spain and then go up through Europe. And then Save the Children was also operating summer camp programs for the refugees who were both at the CFS and who were also at the asylum center. The picture on the bottom left is the major border crossing from Morocco into Melilla. And this is where Save the Children's CFS child-friendly space is currently operational. We did a pilot for return to learning in this child-friendly space, and I just wanted to show you a video of the space constraints that we're working with for child-friendly spaces. And basically, the Save the Children Spain is eight staff who live in Melilla. They are trained social workers, counselors, psychologists, and they are fully bilingual in Spanish and English. So that made it very easy for me to go in and train them on the return to learning activity guides. And then we spent the first 2 days of my visit walking them through the facilitator training module, making sure they were comfortable with the content of the material, and also identifying activities that could be implemented in the CFS as well as in the summer camp programs. The children ranged in age from 4 years old up to youth, 17, some 18-year-olds, and they were a mixture. Most of the youth were young adolescent boys, and most of the younger children was a mixture of boys and girls. I spent 3 days working directly with the facilitators and implementing the activities within the child-friendly space at this border location, and then also at the asylum center with the refugee children. And Save the Children Spain continued to pilot the activities for 3 weeks after I left, and we compiled this feedback into comprehensive learnings and readjusted our activity packs for return to learning based on their feedback. And I'll go into a little bit more detail around what the pilot found, because it was quite similar to the piloting in Spain as well. But the main feedback was that the children definitely enjoyed the activities. It was within child-friendly spaces, it was easy because we had a safe space already established, and it was more about making sure the facilitators who were trained in child-friendly spaces and child protection get the knowledge and understanding around what non-formal education components look like, how simple it was to integrate numeracy activities, literacy activities using the Return to Learning toolkit. There was some challenges around the social and emotional side, because in child-friendly spaces, our facilitators are very strongly trained in psychosocial support. And so the linkage between psychosocial support and social and emotional learning was quite blurred in the piloting here in Spain context. We also piloted in Belgrade, Serbia, and this one, we chose 2 different locations. So Serbia, as many of you know, saw massive influx of refugees starting in 2015. Over 1 million refugees were transiting from Greece through Serbia, Hungary, going to final destinations like Germany, Scandinavian countries. And Save the Children Balkans office, which is based in Belgrade, set up a robust response to the situation. And they are still very active and engaged in the response. There are still children on the move in Serbia, and Save the Children Balkans is operating in 4 locations. We chose to pilot the Return to Learning in Belgrade, the capital of Serbia, because they were operating a child-friendly space in a drop-in center. And then we also piloted in Bogovodic, which is 2 hours from Belgrade, and this is the residential asylum center where families and children are awaiting their asylum claims. They can stay at Bogovodic for up to 9 months, up to a year, whereas the drop-in center in Belgrade, we saw the children and families for maybe an hour, maximum 3 hours, because they were basically just passing through Belgrade and continuing on to their journey. Save the Children operates programming through their partners. And so with this return to learning, we trained 16 facilitators, both Save the Children Vulcan staff as well as their partner staff from the partner organizations. And the first day, the first couple of days, we really worked with the facilitators to review the content, the activity pack. All of the facilitators in the Serbia context were very highly skilled. They were all professionals. Most of them had their master's degrees. They were teachers, counselors, psychologists, and technical experts. So it was a very different context for us to be piloting it because we had very strong facilitators. They took the return to learning toolkit and identified activities that were relevant and were going to possibly be appropriate for the context. Both contexts, we chose different activities. For the drop-in center, because we weren't going to see the children again, we had to be very specific and deliberate on the activities that we chose. And then for the drop-in center, we were able to kind of build off of the activities as the toolkit is designed. So we were able to see a little bit more of how the children responded to the exercises. In Bogavodic, the children do register for school. Because we piloted this in July, we were able to get the children while they were out of school, and the facilitators were really excited that we were piloting it kind of in the summer months to then see how the children would do when they returned to school in August. And some of those children would go to school for 9 months. Some would just return to school for a month before they continue on their journey to their final destination. In both of the contexts, in both Malia and in Serbia, the activity toolkit was pretty well received. Children really enjoyed the exercises. We had a lot of fun delivering the exercises. They're easy to do, and they were very easy to modify. So in both contexts, we had to spend quite a bit of time adapting the activities and also doing the language, changing up the language. And facilitators felt confident about their ability to deliver. We also, in terms of the challenges, like I mentioned earlier, we had to have understanding between psychosocial and social and emotional learning. And then also the language and implementation of CFS, because we were working with a diverse group of refugees in both of the contexts. That was a challenge for us. And then the capacity of the facilitators, particularly in Spain, was not as strong. So, all right, I'm going to hand this over to my colleague, Ali, who's going to talk about HALDO.
Thank you, Sarita. So I'll be presenting the Holistic Assessment for Learning and Development Outcomes, or HALDO. HALDO is an assessment tool that we have developed to use in the rapid and emergency response, and is conducted with an enumerator as a direct child assessment, and it's designed really based on previous evidence that we've collected from projects like Literacy Boost, Numeracy Boost, the International Development and Early Learning Assessment Tool, and the International Social and Emotional Learning Assessment. So we've combined them into this holistic assessment tool that we can use to really get a broader view of children's well-being. We developed HALDO with low resource environments in mind and to fill a gap in the assessment tools that are available in education and emergencies. So the tool identifies overall learner profiles that can help direct programming, but it doesn't measure individual child outcomes. Instead, it's really a monitoring and evaluation tool to compare learning outcomes and assess impact, not at the individual level. We'll talk a little bit more about that. We developed it with time in mind, so it can be rapidly deployed in emergency settings. It requires minimally trained enumerators and can be conducted in homes, in temporary learning spaces, in child-friendly spaces, in schools, or other learning environments, all based off of what we've already talked about with the Return to Learning program. But HALDO is not, again, a school readiness test or an individual diagnostic assessment. It's not going to tell teachers what specific children need to focus on. Although it can be used as a formative evaluation at the programmatic decisions, it cannot be used as an individual formative assessment to track children's individual learning. HALDO, like all of return to learning, also requires a great deal of contextualization, which can be a challenge in emergency contexts. And I think we've already started thinking about that with what Sarita has presented. And so the translation and contextualization is something that we focus on extensively with our team in both pilots that I'll present here. So we developed HALDO to target a wide range of learners. We're looking at ages 4 through 12, and we've piloted beyond that age range as well, because there aren't a lot of assessment tools in education emergencies that have this wide focus. The tool measures social and emotional learning, literacy, numeracy, and 2 executive functioning skills, and it takes about 30 to 40 minutes to administer. We advise that only 4 to 5 assessments be conducted a day for each enumerator to reduce fatigue and potential bias in the data collection. Overall, the tool emphasizes a yes-no response for ease of coding, ease of data collection, and ease of analysis. So here are the domains and specific skills that HALDO measures. HALDO has an adaptive structure in literacy and numeracy, where the first question we ask focuses on a higher skill, and children either move to more difficult skills or easier skills depending on their response. So during the 2 pilots, we fine-tuned these drop-in points by showing us the odds of which question a child would answer correctly and move from one task to another in a sequence. So for example, in literacy, we found that if we ask the child to identify 5 common letters, and if they can, they move to identifying 5 rare letters and move into more higher level reading skills. But if they struggle with the 5 common letters or are unable to do it, then they move to expressive vocabulary, and we ask them how many animals they can name. HALDO, that's just as an example. We also do the same in numeracy, not in social and emotional learning or in executive functioning, because those are not necessarily in the same emergent, foundational, intermediate, advanced levels that Julia already talked about. HALDO also measures the key background and equity indicators. So we want to look at socioeconomic status, which is contextualized to look at common household objects in the area, educational background, which is also contextualized by the location and by refugees and forced migrants and children's experiences of education in their background. And then all of the assessments are going to include age, gender, and the Washington group short set on disability, which focuses on visual, hearing, and mobility challenges or differences. And then 2 home learning environment indicators, and also a question about refugee and IDP experiences to identify the child's experience with migration. Overall, we developed HALDO based on all these already validated tools, which I've discussed, and then we piloted it in Changwali and Romanja, Uganda, and in Dadaab, Kenya last year. The results of these 2 pilots are briefly presented here. And after these pilots, we actually mapped the assessments to the return to learning content that Sarita discussed and identified activities by the skill levels that Julia presented. So we're currently piloting the whole package in Lebanon and have identified the emergent, foundational, intermediate, and advanced skill levels in the HALDO scores to advise facilitators directly on which activities to focus on with specific age groups. Again, not with individual children, but with a general age group. We'll continue this pilot into next month and propose to continue using HALDO with returning to learning content in 3 countries next year. So for the findings of our pilots, the context and the sites in Uganda and Kenya are unique. And so the tool was tailored and translated by our team with deep local knowledge. During the pilots, we identified some major lessons learned about HALDO's first feasibility. First, the tool must be conducted in all relevant languages of instruction to ensure we are measuring literacy and learning outcomes as they relate to programming. Second, the translation process is lengthy, and although we can translate and back-translate the tool before the training, enumerators will continue to find alternative and more child-friendly wording during training and practicing the assessment. Training is about 1 to 2 days of classroom training, and then 2 days of pilot practicing the assessment with children outside of the sample that we're using. But all the enumerators need to use the same wording, and so the wording has to be finalized after the training. We used Kobo Toolbox in these 2 pilots, but we also have developed a paper-based tool given the low resource environment in a lot of emergencies environments. And then finally, given the environment in education emergencies, time is a major constraint in adaptation tool, especially once the training begins. So as much as possible, we need to contextualize the tool before the enumerators even see what they'll be using to collect data. So the main findings for the pilot focus on whether HALDO reliably and validly measured the topics in each domain of literacy, numeracy, social and emotional learning, and executive functioning. We looked at inter-rater reliability and internal consistency reliability, which I won't present here due to time, but to see if the tool was a valid measure of learning, we compared results to children by age. We hypothesized that HALDO scores would be higher for older learners. And we found that we had strong validity in both Kenya and Uganda, where age was significantly positively correlated with all domains, individually and in some. On the table or the chart presented here, we can also see that in Kenya, for example, English literacy had the highest effect size by age, signifying that this has the steepest learning curve as children are aging into DUB, which makes sense given the language of instruction in the DUB and focus on English for older learners and less use of English in early learning. In Uganda, we found similar positive relationships by age and skill scores. In Uganda, numeracy had the largest effect size. So that shows us that we may be needing to focus less on numeracy for older learners and more on numeracy for younger learners, for example. So we're already starting to see how the data can be informing program implementers in terms of the direction of programming. And yeah, with that, we can talk more about how HALDO has been piloted in the Q&A, and we can turn to what comes next. Julia?
Thanks, Allie. Yes, so I'd like to talk to you about our current implementation. As was mentioned, we're currently implementing the full program. So both the HALDO assessment as well as all of the activity toolkits together in the same location in Lebanon. So we've been piloting this in Bekaa for out-of-school Syrian refugee children. And we just completed the first cohort. We're now in the process of reviewing and kind of revising the activity toolkits based on feedback. We just completed the second HALDO assessment, and we'll then be starting cohort 2. And in cohort 2, as Allie mentioned, we're going to be using the HALDO results to inform activity selection by the facilitators. Since we have mapped the HALDO assessment tool to the activity toolkits, we now have that ability to help facilitators in selecting some activities based on the developmental level of learners. And as far as some next steps are concerned, so Allie, do you maybe want to tell a bit about the dashboards?
Yeah, so this is a new innovation that we're working on, and building on the next steps that Julia's already shared about the work in Lebanon. Our focus is on developing a data-driven decision-making in this program. So this has been particularly well received in the Lebanon pilot. We're currently using these dashboards so that facilitators can actually see the results of the assessment. See, as you can kind of see here, the age range, looking at gender, looking at where children are struggling in terms of specific content. So focusing on the literacy, numeracy, and social and emotional learning primarily. And then we can decide where to focus and which aspects of the curriculum to focus on using these results. One of the important things to keep in mind here is that we need to triangulate this with qualitative data. And so we've also begun collecting qualitative information from facilitators about the program implementation, from children themselves on their experiences in the program for those who have finished cohort 1. and with parents to talk about what parents need, especially in terms of getting out of school children back into education. And so that's going to help us identify what's working well and where we need to focus more programmatic improvements on. Yeah, so the results from this pilot will really help us contextualize and fine-tune return to learning in HALDO in coming projects.
Thanks, Ali. Sarita, do you want to talk a bit about our work with the Global Child-Friendly Spaces Toolkit?
Sure. So as Julia mentioned at the beginning, Save the Children is in the process of finalizing and working on rolling out a global child-friendly space toolkit. It's actually going to be more broad to be child-centered spaces. And one key component of this toolkit will be where Return to Learning activity guide will be sitting. And it will have all the facilitator training and activity guides easily accessible. And so we anticipate that this toolkit will be rolled out by the end of this year. And building off of that, we're also developing an app for the toolkit. So the Return to Learning materials will all be readily available, easily downloadable, and the app's focus is helping to contextualize and making it relevant and applicable to the context at hand. So we will also be working with the developer. We are working with the developer and hope to have it ready by, starting to be ready by the end of this year as well. Back to you, Julia.
Thanks, Sarita. And then finally, for next steps, we're also exploring taking this program to various education clusters and providing this training so that clusters and local partners are able to more quickly respond to sudden displacement and ensure that children don't have delayed access to education. And we also, as Ali mentioned, are trying to expand this program to 3 countries in the next year. And so there will be lots of more findings and evidence throughout the scale up of this program that we hope to continue sharing with the wider Education and Emergencies Network. And so with that, I'd now like to hand it over to Melissa, who will provide us with a recap before we open it up to Q&A.
Great. Thanks so much, Julia, and everyone, Sarita and Ali. I think this is a really exciting tool as well as exciting program and toolkit that is really something that I think we can think more about using to reach the most marginalized children. And given the strong focus of the U.S. government strategy and policy, I'm very excited about that. Also excited about the tool and looking forward to seeing how we can learn a little bit more about the tool as we start to look at outcomes and determine, to what extent we're able to measure and address those over time. But it's exciting to be able to have a tool that measures multiple skills at the same time, given that in the new policy we have also expanded into math and also a focus on socio and emotional learning. And so it's really exciting to see a tool that allows us to quickly take a snapshot of all of those skills and to help teachers to really be able to inform their programming and direct programming at the needs of the wider student population. So I don't want to take too much time because I know there's a lot of questions. So I'm going to go ahead and turn over to questions now. We did get some questions that came in ahead of time for the group. And so one of those questions that I wanted to bring up is about the psychosocial support. And so there was a question that came in online about how can we measure the success of psychosocial support interventions for children? So I think maybe I will turn it to Ali to address that question.
Yeah, actually, Sarita brought up a good point in her presentation that there is a difference between psychosocial support interventions and social and emotional learning programming. And so HALDO is particularly measuring social and emotional learning programming, looking at self-concept, empathy, whether a child attributes hostility to another during conflict or disagreement. And we also have an assessment tool, a measurement tool, the ISELA, the International Social and Emotional Learning Assessment, that can more generally measure SEL programming. But the individual psychosocial support projects that involve like casework and counseling, neither of these tools would be appropriate, unfortunately. I would love to hear if there are any best practices going on focusing on that type of evaluation at the case level. I don't know, Sarita, if you've seen anything, but it's an interesting question.
Okay, some of you have started to type questions into the Q&A field, so we can go ahead and address some of those questions now. If you do have questions, you'll see there's a place where you can address those on the bottom of your screen in the Q&A section. So we have one question about Spain, and you mentioned as a finding of the pilot in Spain that there was a challenge resulting from a blurring of the line between socio-emotional support and the aims of the program. Could you expand on that, or in what way it was a challenge? So I think this is a question for you, Sarita.
Thanks. Yeah. So, particularly in Spain, as we were operating on the border, the environment was very stressful, and so the child-friendly space had lots of the children were not able to really be in a zone where they could not be aware of their situation around them. They saw people being abused. They saw people trying to get into the country and being kicked back out. And so when we were working with the facilitators and doing the social and emotional activities, it actually brought on a lot more emotion that they needed a lot more psychosocial support. And so in that particular context, the social and emotional activities for return to learning were not relevant, were not applicable. We had to instead be looking at the psychosocial activities within child-friendly spaces and really kind of, children didn't want to talk about their feelings because in that context, they were all quite stressed already. And so when we gave them space to break through how they were feeling or what things perceive as bullying or how they would show empathy, it didn't translate into the results we were hoping for with the activity. I hope that answered the question.
There was another question about refugees into Spain and Serbia that are really relatively going into pretty rich circumstances, and a curiosity about whether you might be able to share how this works in a resource-deprived situation. I think you mentioned a couple of those in some of the other pilots that you described, but could you at least perhaps highlight what the differences might be working in those different types of situations between, say, Spain and Syria, which are a bit more rich than perhaps Uganda or one of the other pilots that you mentioned?
I think I can just start, and then Sarita, if you want to jump in. So I see here the specific reference to, for example, Northeast Nigeria. And actually, in Northeast Nigeria, we have been using the Return to Learning activity toolkits. But I again want to emphasize that this program is very short term. It's to provide immediate access to learning and also to supporting child well-being. So a lot of activities that do not require alignment to Ministry of Education curriculum and national frameworks, because the whole purpose is that it is temporary and it just gives this immediate exposure to learning opportunities, and really focusing on having children regain that sense of normalcy, having a routine, coming to a place. We, as you saw, we use mindfulness activities. So it's not a very rigorous academic program. It's designed more to make sure that education does not have to continue to be delayed, since it so often is. And it takes so long to, figure out, especially in an area of new displacement, right? Does the Ministry of Education have an existing non-formal education curriculum? Are we going to use that? Who are the teachers going to be? This way, we can quickly have activities that we engage children with. And so they're not very resource intensive. So using it in a place like Northeast Nigeria has actually been perfect. And we're using it right now before the longer term non-formal and formal school interventions begin, which is exactly how it's designed to be kind of this first phase response program that you can use right away. So I know I sort of just addressed two of the questions in one, but I don't know if anyone has anything to add.
Okay. Can you talk about to what extent the learning objectives of the Return to Learning package are being adapted and mapped against ministry learning outcomes in different contexts to facilitate reintegration into formal education?
Yeah, that's what I was just trying to address that question as well.
Okay,
in saying that, yeah, that's very important, I think, for longer term non-formal education programs. Absolutely, because we want to ensure that children can complete a non-formal education program and mainstream into formal schools. But with this, it's more about that immediate access to a safe and supportive learning environment where children can come together and, remember what it is to think about literacy and numeracy and have that development of core social emotional skills. So it's sort of a different approach, I would say. And that's why it's only 20 lessons. It's very short. So it's what you do first as you're setting up the longer term education programs.
Great. Thanks, Julia. I'm sorry to throw that back at you. I was reading at the same time as listening.
No, that's okay.
Sometimes that multitasking is tough. Okay, Jasmine has a question here for you, Ali, about the HALDO tool. And you mentioned that it does not provide individual child outcomes. Could you please talk a little bit more about what that means and at what level the outcome can be interpreted at? So I think we talked a bit about how this is really looking at outcomes at more of the group level to really get an overall assessment, but perhaps, Ali, you want to add to that to do it.
Yeah, that's a great question, and we've talked about it a lot on our side. So if it was to be an individual assessment, we would need to do a lot more rigorous testing to see that we're actually assessing at the individual level correctly. What we do in terms of our analysis is we focus on a center level or school type level, or school itself, and we focus on age. We also include disaggregating by gender. We just don't want to get to a point where a facilitator is looking at the results and they can identify which child has which particular results and try to use that to inform directly how they work with that child. Because again, this assessment hasn't been rigorously tested at that level. And so we could, in the future, do that sort of testing. But right now, we really want to focus on the more general, this is, in this school, ages 6 through 9 are really struggling with X problem, or are really good at social and emotional learning, or what are we looking at in terms of a general approach? So with the facilitators in Lebanon, what we're going to ask them to do is think about what are the ages of the children in their center and what center are they in? And then they'll be able to see generally what the results are of that age range. So that's how we'll be differentiating it at this point.
Okay, another question perhaps for you. How do you evaluate program impact in relation to identified outcomes, especially in situations where participants are transient and given the short-term nature of the program?
These are all great questions. I'm really enjoying the questions. So in terms of the transient nature, we can talk, and Julia and Sarita can definitely chime in on this, but in terms of the evaluation, we may not be able to do like a tracer study where we actually track the same children, but we may be able to focus on a cross-section. We may be able to look at dosage, where we're looking at how long the child was able to participate in the program or how many days they attended return to learning activities. Given that the program is short, we can hope that we'll be able to maintain and track some of the children. In Lebanon, we only have, I think, about a 6% attrition rate, which is pretty good at this point. But we're still looking at, when you're designing how to use the assessment, you have to think about, well, how many children will be in movement in this particular environment.
Question from Josh. Many of the tools discussed here align with the accelerated education program principles and methods laid out by the Accelerated Education Working Group. Can you discuss how the return to learning model might be integrated into accelerated primary equivalency programs in post-conflict environments? Perhaps Julia?
Yeah. Hi, Josh. So I've been talking a bit with some members of the Accelerated Education Working Group about this to try to determine what type of program this is. Is it a catch-up program? Is it a bridging program? And so some of those discussions are ongoing at present. And unfortunately, I don't have an answer for you yet. Might be interested to hear your thoughts. But as far as use I think you said in a post-conflict setting, I think. Sorry, let me see if
Yes, it's a post-conflict setting.
Oh, okay. Yeah. So how could it be integrated into primary equivalency programs in post-conflict settings? I mean, I think this is where one of the biggest components of this program that I think it could be very attractive in a post-conflict setting would be the social emotional learning, because we're seeing that a lot of countries are now interested in trying to ensure that social emotional learning is a part of what is being taught at the primary level in formal schools, and looking at how that SEL can be integrated into national curriculum frameworks, how they can provide training for teachers and support all of that. So I think that's one area that could lead to further exploration and some lessons learned about, when we're addressing children's well-being through the Return to Learning program, and then they do transition back into formal schools, what impact did having that support for their well-being make on their learning outcomes once they're in the formal school classroom again. So lots of good thoughts, and I think as we continue implementing this program in other crisis and conflict affected contexts, it will be interesting to, as Ali mentioned, possibly explore a tracer study of sorts, looking at children once they complete the Return to Learning program and enter a formal school. How is that affecting their readiness, their well-being, and their ability to really achieve greater learning outcomes in the classroom?
Great. Okay. One more question that I have about the assessment, and there was some discussion, Ali, about the Washington Learning Guidance on disability and the questions used there for the during the HALDO. And so I'm curious. This is something that we've been struggling with a bit at USAID, and I'm curious about how if you are able to adapt those for younger learners, how you're doing that in the process of this.
If we're able to adapt them, how? Could you say that again?
So a lot of what we have found in some of the countries where we've been working is that these questions work particularly well for students over the age of 15, but are somewhat challenging for younger students to answer in a reliable and solid way. And so I'm wondering if there were any adaptations that you made or to make them more useful in these circumstances with young students.
Yeah, I think that's a great point. In terms of the inter-rater reliability, we haven't seen much of a problem in using the 3 that we've selected from the short set, which is just focusing on vision, hearing, and mobility. In terms of sort of it may be valuable to revisit that and look at sort of a intra-rater reliability. Is it consistent over time? Is the child still saying the same thing? And maybe we can do that in something like if we are able to track children over the course of a project. It's difficult because we recognize that there may be response bias, but these questions have been, they have been vetted, they have been used in multiple locations. And so hopefully what we'll be getting is children's honest response of their difficulties or differences in vision and mobility. We did find some interesting information in Uganda, and I see that we're out of time, about the spread of disability. And so I think we can use it more to identify where there may be needed more targeted programming at this stage.
Great. Thanks so much, Ali and Julia and Sarita. This was really great, and I think some great information for folks to take back. So we appreciate that and all the answers to questions. We want to wrap up. We're 1 minute past time, so let me just wrap up quickly here. Just wanted to let you know that there is a briefer coming out the Equity Task Team has developed on equity in education. So ECCN will be publishing that later this summer. And if you haven't already, please register for a free ECCN account. The link is here so that you can receive announcements about other upcoming webinars and opportunities to engage the community in the future. Thank you so much, everyone. Have a great rest of your day.